Welcome back. Many people suffer from constant nagging aches and pains, but help is on the way. Today we have a chiropractor with us, Dr. Robert Hausman of Hausman Chiropractic, to show us a few techniques and talk about some of the benefits of chiropractics. Thanks for being here today.
Of course.
Our patient is already ready to go.
She's ready to go.
And so what are we talking about today? Why do people come in to see a chiropractor?
Well, the most common reason to see a chiropractor is for various sorts of pain, like neck pain, back pain. We treat a lot of headaches and migraines. Those are the things that people most commonly associate with chiropractors because we help restore motion to joints that might not be moving properly.
Now, do you ask them questions up front, where does it hurt, or do you just start cracking?
We don't just start cracking. We do a full health history, including their neck and back pain as it might be, but also anything that might be related to that, or chronic pain that they've had, surgeries in the past, a full health history that you would expect at any doctor's office, just so that we can be aware of, what sort of history they have.
So let's say our patient today has neck pain or back pain that's bothering him. How would you kind of assess the situation?
Well, she's ready to go here. Normally what I would do is I would start with her face down like this because a main thing that I palpate for is differences from one side to another, essentially asymmetry. So you've got bones all along your back here, and they all move individually. And every once in a while, one or two of those might get a little bit stuck, and they might get fixated. And so my job is to feel for where those are, and then use an adjustment technique to help restore that motion.
Now, what is it? Is it a pinched nerve that's causing the pain? What is it normally?
It can be. A pinched nerve can be involved, but not always. Sometimes it can just be that that particular portion of the body or of the spine isn't moving properly, and then the muscles tighten around it, and you can feel the muscle pain, the bone pain, or it could affect a nerve, and you can have a pinched nerve kind of pain as well.
So you're basically going in trying to loosen everything back up and adjust it back to its normal state, I guess.
Essentially, yes.
Right.
Yes.
So when would you recommend a patient try chiropractics as opposed to some other techniques out there?
Well, I usually recommend that the most conservative form of care is a good place to start, and if you can't get help at a place like my office, then there's always referrals that can take place to an orthopedic person or to physical therapy, anything like that. We should all work well together. But what I do is working with the body's own natural ability to heal itself, and so it's a good place to start, kind of at the bottom of the totem pole, essentially.
Now, someone comes in for a treatment. How long can they expect that to see the benefits, and when might they need to come back in?
Sure. It depends on the chronicity of the pain. If it's a car accident versus someone who sits at a desk all day, usually you can expect some immediate relief, but those changes won't last necessarily because your body kind of wants to reset back to what it was doing before. So it takes a certain amount of intervention from us in order to get those changes to stick, so to say.
Right, and so obviously neck and back are going to be the most common areas, but what are some other areas that need adjusting every now and again?
Well, if you're an athlete who runs a lot, lots of times there's pain in the hip or maybe ankle pain. I treat primarily the back, but I treat extremities as well. So people come see me for shoulder pain, knee pain, really any part of the body, mostly revolving around the joints, but we work the muscles as well.
And all age ranges, or?
Yes, there's any number of childhood problems that we help with, especially when people start to grow and they start having growing pains. Sometimes an adjustment can help their body adjust to that. And all the way up into a lot of older patients, they start to have aches and pains as they get older, and we can treat all ages.
And you said a lot of people come in a little bit fearful that something's going to hurt.
There are a lot of misconceptions or fears about certain chiropractic techniques. Most often it has to do with the neck adjustment because people don't like to hear popping in their neck.
Right.
It's normal. I totally understand, and I try to I try to abate my patients' fears by explaining that what we do with the neck adjustment is simply within your normal range of motion. We're just helping give maybe a joint or two a little boost to help it move better.
Now, when patients get up off the table, I mean, are they ready to go, or do they need to kind of take it easy and let everything set in?
Again, it can depend. Usually, initially with care, we would like them to take it a little bit easy, but in general, your body likes to move. It wants to move, so I try to get my patients back on the running trail or back wherever it might be as soon as we can.
All right. Chiropractor Dr. Robert Hausman, thanks so much for being here.
Thank you.
All right. We'll be right back.